Hi everyone, it's Lisa Moeller with Orthodontic Practice US, a MedMark publication, and welcome to another edition of Doc Talk Dental. I'm very excited to be here today with orthodontist, physicist, and the inventor of Brius, Dr. Mehdi Peikar. He received a master's degree in condensed matter and quantum mechanics from the University of Illinois, then completed his PhD in biomechanics and biophysics at Johns Hopkins School of Medicine, and did a 3-year residency program in orthodontics at UCLA. I'm super excited to have him on the show today. Thank you so much for being here, Dr. Peikar, and welcome.
Thank you very much. Thank you very much for having me. I am good. How about you?
Good, good. It's lovely to have you today. So as a physicist, how did that impact Brius?
Yeah, so, I think that physics part of it and my interest in physics really helped. I think when, for example, let's say everybody looks at orthodontics from a point of view of like an orthodontist, but you might not look at the other ways that are the possibilities. When I'm thinking about physics and biomechanics of Brius, maybe actually I have it in my bag. Maybe I can give it to you. It looks very simple. Actually, if you look at it, it might look like a tiara. But
I like tiaras.
Yeah.
I'll put one of those on. No,
Yeah.
I'm kidding. It does look like a tiara.
Yeah,
I saw the video.
Yeah, it looks like a tiara. It might look very simple, but in reality, there is a lot of biomechanics and calculations behind it. At the beginning, when I designed the Brius for the first patient with the team, maybe for each patient, for each jaw, it took us 100 hours of calculations, computational calculations to design one jaw. So 200 hours for 2 jaws.
Yeah.
Right now, it's like in a matter of a few minutes, it designs everything. So there is a lot of biomechanics behind it. And maybe I can explain it a little bit more. Brius has an anchorage base. And each tooth, that anchorage base sits on the gum. And each tooth is connected to that anchorage base through flexible arms. And each arm is customized for that tooth. Mm-hmm. So the design of each arm is different from other arms. The thickness of that arm is different from the other arms. And that arm is specific for a tooth of a certain patient. So if you go to another patient, the arm, the thickness design is going to be different. Mm-hmm. And that design applies the right force and torque to the tooth, and it brings it from its initial crooked position to its final ideal position. And to do that, we do all the calculation, how much force we should apply. More force for this tooth, less force for this tooth. We even look at the gender of the patient. We look at the ethnicity of the patient. We look at which jaw, upper and lower, is different. The type of the tooth, for example, if it's a canine, it's incisor, all these things will affect, and the software gets all the data and then designs.
I was going to ask how you did that. Do you use CBCT or how do you collect the data?
Yeah. So the way it works is that the orthodontist send the intraoral scan of the patient. Mm-hmm. And CBCT is an optional, which I really suggest.
You're pro, yeah, that's good.
Yeah,
I think it's a must, especially in orthodontics.
Yeah, for every single of my patients, I use CBCT.
Good, I love to hear that.
Yeah, because we can see the roots and we can see the bone. Mm-hmm. Because Brius is very powerful, and when you do the treatment planning, you want the roots to stay in the alveolar housing, which means stays in the bone. So
it's got to be very precise, right? Obviously.
Yeah. And after the doctor sends the scan and CBCT to us, in the computer, we make a virtual treatment plan based on the instructions that the orthodontist gives us. It's very important to have very good instructions, and we need a very good treatment plan by the orthodontist. After the orthodontist approves the treatment plan, we make the Brius. Also, we make another thing, which is a template for gluing the brackets. Brackets are the handles on the teeth. Mm-hmm. We call it digital bonding tray. So the orthodontist glues the brackets to the teeth with that template. And the bracket positioning should be very accurate. And with that template, with that digital bonding template, we call it DBT or digital bonding template, mm-hmm. we can do it very precisely. After that, orthodontist stretches or squeezes these arms of Brius and engages them to the bracket. And that's when we said, let it cook. After that, cooking starts.
Right.
Basically, those are like springs. Actually, the material for these arms is a material called nitinol. And those are, if you bend them, it's a shape memory alloy. If you bend it, it's gonna bend back. So these springs are gonna stay where the teeth are aligned, and they start applying force to the teeth and bring them from their initial crooked position to their final ideal position. So, and with one Brius, we can treat simple to moderate cases. If the case is very difficult, we do like with 2 Brius or something like that. And this is very, very amazing to me that, you know, I had patients, because, you know, right now I live in Dallas, in Texas. We had a patient whose husband is part of our team, and they live in Bay Area. So she flew to Dallas. We placed the Brius for her. Although I didn't do it, my assistant did it. You know, that's the good thing about it, that, you know, the treatment plan should be done with a specialist, but just doing that part to bond it and place it inside the mouth, my assistant can easily do that. So my assistant placed the Brius for her, and then she flew back to Bay Area. 5 months later, she came back, and then I removed the Brius. The treatment was done. So I saw the patient just twice, but we could treat the patients, and, you know, that really helps not just me as the orthodontist, you know, because that saves me a lot of time. And, you know, personally for me, when I have more time, because, you know, right now I'm not doing traditional braces anymore. After I graduated, I'm not doing any, I just do Brius. I don't do any other.
Right.
And I have time to talk to the patient. Before, you know, with traditional braces, you have to go and adjust the wire. You have to tighten it. You have just a few seconds to say, hi, how's it going? And then you have to say, open your mouth. But with Brius, we have time to connect to the patient. Although, you know, it depends on the orthodontist. You know, some orthodontists, they have more time. They might think about, okay, I'm gonna do marketing for my practice. I'm gonna work on my social media. Or somebody might think, okay, I have like 2 days extra in a week, and I see the same number of patients. I want to go on a beach. I want to go on a trip.
Yeah, it frees up some time.
Exactly.
Not only for the patient, but for the doctor. Yeah, absolutely.
Yeah. So that's the doctor's perspective. Now think about the patient. You know, my patient, if I wanted to treat her with traditional braces, that meant I had to see my patient for more than a year and a half probably. And I had to see her every 5 weeks, 6 weeks. And just imagine, it was not possible for me to see her when she was in Bay Area.
Right.
And, you know, 75% of the market is teenagers. And we are talking about a teenager plus a parent. So when you save...
So sometimes 2 teenagers.
Sometimes, that's true. That's true.
Once in a while, right?
Yeah. Sometimes, you know, actually these days what I see, you know, the first teenager comes, and then the second one wants it, and then the mom says, actually, can I get Brius too? So it becomes like
it's a family
deal.
It
becomes a family deal.
Nice.
Exactly.
Okay, here's a $64 million question to you. With traditional braces, eating and food is an issue. How does that work with Brius?
Actually, it's very interesting. If you compare it to traditional braces, you know, traditional braces connect the teeth with a wire, so flossing is very difficult. But with Brius, there is no wire connecting the teeth, so flossing is very easy for the patients.
Oh, that's nice.
Yeah, so that really helps with the oral hygiene. And when we are dealing with teenagers, oral hygiene is way more important.
So, doctor, where do you see your career in 5 years, in Brius 5 years from now?
Yeah, so the way I look at Brius is helping a lot of patients to get a better smile. Again, sometimes people think orthodontics is all about straightening teeth, but for many patients, it's way more than that. It's psychology. It is them feel confident, and that could be an adult or that could be a teenager. You know, it's sometimes very, very impactful for their life. So my goal is that we help a lot of patients, millions of patients, to have a better smile with Brias. And to get there, you know, right now again, aesthetics is very popular. So aligners are growing, but there is a part of the patients that they just need traditional braces, most of them teenagers, that we don't have a solution, aesthetic solution for them, especially late teenagers. They cannot do aligners because of their compliance, because aligners are not effective. On the other hand, they need an aesthetic option, and Brias is the solution for them. It can help them dramatically. Although there's an interesting thing, early teenagers, they don't care about aesthetics, they care about colors. So
yeah, right.
yeah,
There's a lot of options, a lot of crazy options out there right now.
Yeah, exactly. But I have a solution for them, you know, because moms, they care about oral hygiene of the patient. So when we talk about Brias, they want like a 12-year-old to have Brias because of oral hygiene is going to be better. But the kid wants colors. So I put some non-functional buttons on the outside in front of the teeth.
Oh, I love that.
And, yeah,
that's fun.
Yeah, and then I change the colors. Each time I see them, it's okay, what color do you want? So the kid is going to be happy, but also the mom is going to be happy, and also we're going to save the time. We talked about saving the time of the mom or the dad, and also the kid. You know, the kid doesn't have to skip classes. And also it saves the time of the clinicians.
Well, the kids don't like that. They want to skip classes.
Actually, that's true. That's true. I agree with that.
They're like, I want to go to my orthodontist, please.
That's true.
Exactly. So overall, how does Brias impact the orthodontist's office? Like, I know we talked about from a time perspective, but how about monetarily?
Yeah, sure. So from the orthodontist point of view, profit per visit increases dramatically. You know, I gave you an example of, I saw a patient just twice, although the scan was sent to me by an orthodontist in Bay Area. If you remember, the patient was in Bay Area, and we are in Dallas, so the scan and records were sent to us. So I saw the patient just twice, and then, you know, the charge for the patient is going to be the same, the cost for the patient, but profit per visit increases dramatically for the orthodontist.
Because you said they could work the same 2 days and make about the same amount of money, right?
Yeah, exactly.
And then if they added a couple days, obviously, if that's what they want to do.
Exactly. That's going to help the orthodontist financially, and also it's a win for the patient, time-wise, oral hygiene, aesthetics, all those things that we discussed. Other than these things, I am thinking about something else, about expanding the market. There are a lot of patients who cannot get orthodontic treatment because of different reasons. Traditional braces doesn't work for them because of like aesthetics reasons, because they have to go to the orthodontist many times. And aligners don't work with them because of compliance, because of other problems that aligners have.
Yeah.
Right now, we can expand the market. For example, a few months ago, a patient drove about 2 hours and a half, came to my clinic and wanted to get Brias. And he said, no, I am an engineer, I totally understand it, this is amazing. And I was like, you know, you're driving 2 hours and a half, you really don't need to. You know, I know another orthodontist that is a Brias provider. So I referred him to that orthodontist. But this is gonna be a practice builder. You know, if you differentiate yourself, you know, it can really help you to get patients come to your clinic. Maybe like in 2007, 2008, 2009, 2010, if you were doing aligner therapy, you could differentiate yourself as an orthodontist. You could be in a very crowded, competitive location, but still people come to your clinic because you're doing something different. People have some needs that traditional braces could not do, now aligners can do. But right now is the time for Brias. You can differentiate yourself with Brias, and we have a lot of orthodontists that they are switching their practice to Brias. You know, with aligners, you cannot say, I have a practice only based on aligners. It's impossible.
Yeah, right.
Because what if a teenager says, I'm not going to wear the aligners?
Yeah.
You cannot continue. The treatment fails immediately, right?
You need options.
Exactly. What with Brius, you can see all the patients with Brius. You can treat all the patients with Brius. So that's a possibility that has opened. And many of our doctors, if you go to our social media, if you go to @Brius, for example, on our Instagram, you see the testimonials of our doctors that they want to switch their practice. They have switched their practices to Brius. They're not doing traditional braces. And as a matter of fact, I don't do traditional braces anymore. It really.
Well, why would you?
Yeah, exactly.
You have a better system. So how many cities around the country do you have Brius? How many offices around the country, or do you concentrate on certain areas, or?
No, we are focused on the U.S. right now. We're not. We go international later, but we're focused in the U.S. and we have practices all over the U.S. If you go to brius.com and you go to find an orthodontist, you just enter your zip code. You can find an orthodontist near your where you live or where you want to get orthodontic treatment, and you can go. And all of these orthodontists are, maybe I call them like pioneer orthodontists. When there is a new technology, those are those early adopters, top orthodontists, or in any profession, I would say. They, embrace the new technologies, and you can find those orthodontists are special orthodontists. So if you go to our website, you can find them, and they are great orthodontists. We get a lot of good feedback from them, and they have helped us to get where we are right now. Those orthodontists really helped us to get to where we are right now.
Oh, that's great. That's great. So as with traditional aligners, when you're at a restaurant eating, it's not the most convenient when you've got to take them out and have your meal. So that's got to be a bonus with your product, right?
Yeah, absolutely. So with aligners, one of the other problems that exist is that when you go to a restaurant with your colleagues, you go on a date. When you want to eat, you have to take it out, right?
Yeah.
So you cannot.
It's not
have
sexy when you're on a date to have to remove that. Yeah.
No, and it's
no
very
good.
embarrassing. Either you have to go to a restroom, do it, or in
Yeah.
front of others.
Yes.
But you don't have these problems with Brius. So what I noticed with Brius, at the end of the treatment, I have heard it many times. It's very interesting. The patients tell me, "Can you keep it there as my retainer?" But when you're dealing with something that is removable, usually patients want to just finish that. You move on. You want to move on. For example, with aligners, after you're done with your aligner therapy, you don't want to have something removable. You want a fixed retainer. And
Right.
I have heard it about Brius a lot, that they want to keep the Brius, although we don't want to do that. But all of
That's
these.
a compliment to you,
Yes.
that it's that comfortable in their mouth,
Yeah.
right?
Yeah.
That's good.
Okay.
Well, I think your product's amazing, and I am so excited to get this message out there and to have you continue to build your company.
Thank you very much, Lisa.
Great job to you. Congratulations.
Thank you. Thank you very much.
Take care. So that's going to do it for another edition of Doc Talk Dental. I'd like to thank Dr. Mehdi Peikar for joining us today, and I'd like to thank our sponsor, Brius. For more information on their amazing product, please visit brius.com. That's BRIUS.com. As always, for everything orthodontic, please go to orthopracticeus.com and subscribe for the latest information. To learn about any of our other publications, please visit medmarkmedia.com. We will see you back here on the next edition of Doc Talk Dental. Until then, take care, everyone.